I want to welcome you again. This is the Q&A session for designing a comprehensive county prevention system. This is a follow-up to the main conversation on the same topic that happened on our August 17th forum. We will drop a link in the chat that takes you to our page where you can watch the recording. And we will also drop a second link to the slides for today's 3 tutorials. Before we get started, I want to introduce you to our first speaker. You would have met Dana in the webinar on the 17th. Dana Blackwell is the Senior Director of Strategic Consultation and brings over 20 years of child welfare and public policy experience to her role at Casey Family Programs. In this capacity, Dana leads Casey's work in California, including statewide partnerships, initiatives, and systems improvement activities. Good morning, Dana.
Good morning, Stephanie. Good morning, everybody, and welcome again to part 2 of designing a comprehensive county prevention system. We hope today's Q&A session, and the way we have it structured, is responsive to what we heard from you in the evaluation from part 1. And we hope that it'll give you a little bit more depth and mostly to help you with the practical application of the tools and the concepts that we discussed a couple of weeks back. Our next learning forum in our series is on September 21st, and it is ensuring quality and fidelity to achieve outcomes. As always, you can register on the Caltrin website. So without further ado, I would like to welcome back our esteemed colleagues and panelists. First, Jennifer Rolls-Royce, who is the Director of California Evidence-Based Clearinghouse for Child Welfare and California Training Institute. Michael Steele, Senior Policy Analyst at Chapin Hall at the University of Chicago, and Wendy Wigman, who is the Project Director for California Child Welfare Indicators Project. And as always, our moderator, Kush Cooper from Implementation.
Good morning, everyone. So we've got a informative session set up for you today. We're in the welcome portion, so we're in our 9 to 9:10 portion, and once we get set up, we will send you over into breakout rooms. There's 3 available. You can see those 3 at the bottom of the screen here. One is Theory of Change and Logic Models with our presenter, Wendy Wigman. Next, Asset Maps and Service Inventories with Jennifer Rolls-Royce. And last but not least, Service Array Gap Analysis with Mike Steele. And the way it's going to work is we're going to run 2 cycles of exactly the same tutorial. So you will have a chance to go to 2 of the 3. And so this would be a great time to, if you've got partners in the Q&A session with you, to text them and figure out which one you're going to go to, which one they're going to go to. You can choose 2 of the 3, and they will all be recorded. So if there's one you missed and you wanted to see it, you could just go straight to the Caltrin website and look at the recording. We're all going to come back to the main room this Q&A session. We haven't done that the last 2 Q&A sessions. We're going to come back, and for those of you that stayed till the very end, you're going to get a sneak preview of the implementation guide that Casey and Implementation have been working on in partnership with our colleagues at CDSS and other experts from around the country. And we'll give you snapshots of that. So they will be in the recording, and the guide itself will be released on September 9th on the Caltrin website. Right. Okay, so as promised, here is a sneak preview of the implementation guide. And get to, let me say a few things about it before I show it to you. Oh, hang on. Sorry, hold on, folks. Wrong button. That's the right button. Okay, so a couple of things to keep in mind contextually as you see what I'm about to show you. Okay, so you can see in the title, it says CVP Implementation Guide Plan Development Phase. What that means is that this iteration of the guide is intended to have folks do the work that's required in order to write their comprehensive prevention plan, right? It doesn't get into the details of building things that you will need to build next year as you implement that plan, okay? So just for the plan development phase and only the readiness domains that are needed for you to be able to write your CPP. It will be tempting for people to use the guide to build out your prevention system, right? Which is why I'm mentioning that this one helps you get your plan done. Another iteration of the guide will be released in 2023, which will be aimed at implementing what you've put in your CPP. That said, if one develops the work products that are reflected in this guide with implementation planning in mind, and we've designed it that way, they can then be used as a foundation for your communications and your implementation efforts in 2023 and beyond. Because otherwise, if you don't sort of in parallel also do the work to set yourself up successfully, and you're just gonna, sit at a desk and bang out a CPP, you're gonna kind of be starting over next year, doing all the implementation related preparation that you needed to do. Okay, so just keep a couple of those things in mind as you look at what I show you. All right, so I've said in many of our prior sessions that we have readiness domains. There are 9 readiness domains off of which we have built this learning series and off of which we're building the guide. All right, so you'll see those domains reflected. Also, what you're going to see is a raw version. It's not the version that's been gussied up and posted online yet. As I mentioned earlier, that'll be ready on the 9th of September. And we'll on the Caltrain website, and we'll send out a communication to all of those of you that have been with us to date that it's ready to go. All right, so without further ado, right. So the way the guide is going to be laid out is it's going to have these 3 columns. Okay, and in the first column are work products or artifacts that we recommend get created so that you're set up well to A, to write your plan, and B, to do the work in 2023. None of these are requirements so necessarily to put in your CPP, right? These are all artifacts that we think will help you write the CPP, right? But I want to also do a disclaimer that these are what we think are needed as implementation experts. They're not requirements to, these are not appendices to your CPP, although they could be, right? The middle column are the action steps that would be needed to be able to output those work products, okay? And in the far right column, we've done a crosswalk with 3 items. The first crosswalk right now, it's depicted in purple. These are the components in the block grant letter, the state block grant letter, also known as ACL 2223, that tell you exactly what the required elements of the plan are. So that required component number 4, required component number 5, required component number 7, all go with this particular readiness domain. Orange are other relevant passages from that same state block grant letter, okay, that are not actually the requirements for the CPP, but are relevant. And then in blue are relative passages from AB 153 if they apply to that particular area, okay? So that's how it's laid out. And as you can see across, here's our first readiness domain, governance, okay? So with regard to governance, we say that if you've, at least to some degree, and it doesn't have to be complicated, but you've, at some degree, chartered, you've selected who your oversight body is going to be, ILT, Prevention Cabinet, some other one, you've chartered them. Folks have had a conversation about what it is we're doing and what are our success factors and when will we know we're done and who's involved and what are the roles and responsibilities. There should be some sort of roadmap or timeline that everybody's moving to. A communication plan, internal and external, right? And for external, we'll be able to link to a media toolkit that we've got in development. We will have a tool and an example of that tool or a sample of that tool filled out, linked to each of those bullets you see in the first column. Okay, so that's the governance domain. Here are the things that would need to get created. Here are the steps you'd have to take to be able to pump those out. And here's what component of the requirement it fulfills. Okay. So if you look here, one of the things it says, well, describe how you did your cross-sector collaboration. Describe your efforts to engage tribes. So here we've got, okay, so create guidance, reporting requirements, and clear feedback loops between the governing agencies and tribes, right? And that would help you with component number 5. And you would want to say in your charter how you were going to engage with tribes. You'd want to do the same thing with stakeholders. Reflect in your charter how you're going to do that. If you haven't done so then let's go to the next domain, stakeholder collaboration. If you haven't done community engagement yet, or would like to do it again, for some reason you've done it in one aspect or another, we'll link to a community engagement tool you like. Is that the only community engagement tool that you'll be able to find? No. And in fact, CVSS and other folks like Chapin Hall will have pages of resources, right, available for you. If you don't like this tool, you can use another one. But the analogy I use is, this is to build the basic IKEA desk, right? Here's the little paper and the bag of tools. Doesn't mean you have to use the tools that came in the box, right? You could use another Allen wrench, but we're at least giving you a basic, what one basic Allen wrench might look like here, okay? So there's stakeholder collaboration. Again, your charter should fulfill how you do all that if you describe it correctly, and your efforts for community engagement. Next domain, as per the ACL 2223, they want strategies for the use of the integrated core practice model, right? So here's some work products. There are ICPM leadership and prevention strategies that one of our colleagues, Richard Connect, has presented on at one of these learning series that we've had for you. And we will have examples of how to reflect those in the charter. Right? You might as well reflect the leadership behaviors for ICPM in your governance charter, for example. All right. So those are the governance, stakeholder collaboration, and integrated core practice model areas. So the governance piece reflected on this first page is more straightforward than what you're about to see, okay? This is probably about I would say 25% of the work to get your CPP done, right? About 70% of the work to get your CPP done is reflected on these next two pages, which is actually your program design. All right, and this is actually relevant to the discussion we've just had in our learning series and the Q&A session. So one of the things to keep in mind when you're doing your designing of your FFPS, right? And remember, FFPS is both your strategies around prevention in general, primary, secondary, and tertiary, as funded by things like the state block grant, plus strategies around FFPSA. So when you put state block grant and FFPSA together, you get FFPS, so to speak. So when you design that, you're going to have to do these two parallel analyses. One is the FFPSA funded service system, right, which is nested inside of a larger non-FFPSA and block grant funded service system. Okay. Before you do that, you're going to need to have a vision statement and a theory of change and logic model. We talked about those today, and we'll have tools linked here as to, here's how you would come up with one. Here, fill in the blanks for a theory of change, right? Go back and look with your group, and then how would you put that in a statement like this? So we'll have links there. Then your current situation, what's going on right now? Who is your target population and what are their needs and what services do you have? You're going to have to assess that for FFPSA eligible candidate populations and services, right? And you'll have to do that again for what we're calling here non-FFPSA target populations, other populations that are disproportionately represented perhaps in your system, but are not necessarily on the FFPSA candidate list, right? So you'll have to get target populations, needs assessments first in each of those areas, then document your current service array that you have to deal with those needs and those target populations, right? So who do we have? What do they need? And what do we have right now to serve them? And based on that, you're going to put that all together, which is doing a gap analysis. And Mike's been talking to us about that today, which is here's who I have and what they need. Here are the services I have. What are the gaps? And how can I use the funding strategically to fill those gaps? Right? And so you should be, you're probably going to need some sort of candidacy needs assessment for FFPSA. You're going to need a target population needs assessment for other populations. You'll need FFPSA eligible service array, which is largely EBP based. And then you'll need a non-FFPSA current service array with regard to those needs for that target population. And that may have EBPs in it and non-EBPs in it. Okay. And both EBPs that could be funded by FFPSA and EBPs that wouldn't be. You could still use the block grant for those EBPs, right? So you need these two service arrays, and then you're going to put it all together in the gap analysis, and you're going to come up with a proposed service array, right? And for your CPP, I know it's a lot of work for these two little sentences here, but it's component 2, description and rationale for candidacy population and services to be included in the plan. You're going to have to do this work to come up with that. Okay. So that's the program design area. We've been talking about that a lot today. This is the second half of the program design, you could say. The front of the hand is the services, and the back of the hand is how you're going to fund them. Okay. And so there are going to be tools to do cost modeling, that will link behind each of these. Some of these are templates that CDSS would be developing anyway, like a block grant spending plan. We just link those here. We might link to some of those templates that CDSS is creating and putting on their page. And there also is going to be at some point a prevention funding guide, right, with regard to all the other funding streams, in addition to the block grant and FFPSA that could be brought to bear. We'd be linking that here. Okay. But essentially, you're going to have to come up with cost models and prevention projections on the FFPSA side, and then cost models and projections on the non-FFPSA side. And then you're going to also have to come up with funding protocols and policies and joint protocols around payer of last resort if you're on the FFPSA side, right? You know, that doesn't apply to the non-FFPSA side, but you still probably want some written process, especially between all the cross-sector partners about, well, here's who's funding what, and we're going to count that in our county-wide prevention strategy.
Koosh,
Yeah.
I just wanted to give you a time check. It's 10:29.
Yep. And we got one page. Thanks, Dana. And then here are the only two areas that are going to be needed for the CPP. There are other readiness domains like automation and reporting, but you don't need those yet to develop your CPP. You will have to do a training assurance and a safety assurance and a model fidelity assurance, and how CDSS wants you to do that will be linked here. And we do recommend you have some preliminary conversations before you sign site assurance, but these are preliminary conversations we would advise that you have. So this is just a sneak preview of the guide. And you don't need to wait for a template to get started on some of this, right? Again, to reiterate, I know some people keep waiting for a template. You don't need to wait. You get started now. All right. So there's the sneak preview. I have used up all of our time. Thank you for joining us.